Good afternoon and welcome to the Alliance for Home Health Quality and Innovation webinar on the 2018 Home Health Chartbook with Avalere. My name is Jennifer Schiller and I am the Director of Policy Communications and Research at the Alliance. By way of background on the Alliance is a 501c3 research foundation celebrating our 10th anniversary in 2018. The Alliance's mission is to lead and support research and education on the value home health care can offer to patients in the evolving U.S. healthcare system. Working with researchers, key experts, thought leaders, and providers across the spectrum of care, we strive to foster solutions that will improve healthcare at home through quality and innovation. Today's webinar will serve as an overview for the Chartbook, how to use it, key data from this year's edition, and more. The Home Health Chartbook is an annual compilation of data and statistics compiled by Avalere and commissioned by the Alliance, which offers a glimpse of home health patients, the home health workforce, organizational trends, and the economic contribution of home health agencies. Now I'd like to welcome today's speaker, Erica Breeze. Erica is a director with Avalere, a DC-based healthcare advisory firm that offers consulting services, data analytics, and business intelligence products. Erica advises clients on developments and trends in the acute and post-acute healthcare sectors and helps them navigate reforms in payment and delivery models, such as bundled payments and accountable care organizations. She assists clients in understanding their strategic opportunities in response to changing market dynamics, as well as legislative and regulatory reforms. Erica has an MBA from the University of Virginia and a BS in Neuroscience and Behavioral Biology from Emory University. A few quick housekeeping notes before we get started. Erica will speak for about 40 minutes, and we will leave the remainder of the time open for questions. All lines will be muted throughout the webinar, and you can submit questions through the questions box in the control panel. Within about a week of the webinar, slides and a replay of the webinar will be posted to the Chartbook section of the Alliance's website. And with that, I'd like to turn it over to Erica. Thank you.
Great. Thanks so much, Jen. We are very much looking forward to presenting this to you today and walking through the Chartbook. So just to orient everybody, the purpose of the webinar is to walk through the research that Avalere has conducted on behalf of ACI and the Home Health Chartbook, as Jen said. And really the goal of this research is to identify what beneficiaries use home health, including their demographics, their clinical profiles, and things like that, how Medicare beneficiaries are using home health, and what impact and trends are facing the home health industry at large. So we're going to go through just a handful of charts from the Chartbook, but it is a much larger document, and I encourage you to go to the ACI website to look at the entire, the whole Chartbook in its entirety. But this will just give you a taste of the various sections. I'll try to mention what else is in this section that we're talking about. And go from there. But one thing to note, and for those of you who are familiar with the Chartbook, this is actually the 5th time that Avalere has developed a Chartbook. So we have done this for the last 5 years. So the format remains relatively the same. We've added a few new charts over the years, but what this really allows you to do is create some trended analysis over time, because now there are 5 Chartbooks. So in many ways, you can look at data going back to 2012 or 2013, all the way up through 2017, which is the most recent year in many of the 2018 Chartbook charts. So, you can buy multiple Chartbooks. They're all available on the ACI website. So we really encourage you to use these, mix and match them, because there's a lot of great information there. And now we do have that trended over time. To develop this Chartbook, we reference several data sources, including the Medicare Current Beneficiary Survey, which is a survey of Medicare beneficiaries, both beneficiaries in fee-for-service and in the Medicare Advantage program, and it helps give a sense of the demographics and the patient kind of needs of home health users. And then we also use the Medicare claims files, so a lot of this information is based on claims. And then finally, some other publicly available sources. So there's a range of data included in here, and it really tries to give a holistic view of the home health industry. So let's just jump straight in. So as you can see here on slide 6, it's the table of contents of the whole chart book. So we walk through the demographics, the clinical profile, post-acute care market more generally, organizational trends, the economic contribution of home health agencies, and then a little bit on patient outcomes. So this is just the general kind of the sections of the chart book. And then we will kind of during the webinar jump into each of these, look at a handful of charts from them. And then, again, the whole document is online. So there's tons of information here. I think there are, 60 or 70 charts included. So lots of things for you to dive into and, again, look across time. So we're going to start with section 1. And section 1 is the demographics of home health users. So section 1 looks at home health users compared to other groups, including all Medicare beneficiaries and then skilled nursing users. So you'll see charts that look at, home health users to all Medicare, or then home health users to SNF users. We cover a range of demographics here, such as age, gender, marital status, geographic distribution, race, income, chronic conditions. It's really a range of items throughout this section. This is definitely the largest section in the chart book, and it definitely gives a lot of great information that really highlighting the unique population that Medicare fee-for-service home health tends to treat. So let's just jump in. Again, this is just a handful of the charts. So on chart here, this is the first chart in the whole chart book, and it really looks at the age distribution of home health users and all Medicare beneficiaries. As you can see, home health users tend to be older than the broader Medicare population. And that probably doesn't surprise any of you who are in the home health industry, but you do see, particularly over here on that 85 plus bucket, you're really seeing a much bigger proportion of the population being 85 plus than the general Medicare population. And again, this is individuals in Medicare who are using home health. So on the next slide here, we wanted to take a look, just given all of the discussion of Medicare Advantage and everything that is changing in the Medicare program and the growth of Medicare Advantage. This is a new chart for 2018, and it looks at the percentage of Medicare Advantage beneficiaries and fee-for-service beneficiaries that use home health. And you see that it's very similar, which, we didn't look into how these two different whether Medicare Advantage and fee-for-service are using home health differently, but we did see a similar portion of patients using home health. Now we're just going to, on the 10th slide here, look at the demographics of selected characteristics of the home health users. And again, this one now we're comparing home health users to all Medicare beneficiaries. And you see that on basically every single one of these demographic counts that the home health users, which is the left column here, are older, more, have more acute or kind of more chronic conditions and things like that. I think of note, we talked about the age, but you really see major differences in the ones that are in the orange boxes here of, 85% or almost 86% of home health users have 3 or more chronic conditions compared to only 63% of all Medicare beneficiaries. You see that all home health users have, a third of them have, ADL limitations, whereas only, just over 10% of all Medicare beneficiaries. So you're really seeing that home health treats a much more acute, highly complex population, more likely to have incomes under 200% of the federal poverty level. So there's a lot going on here, and I think that just speaks to the important role that home health plays in the healthcare continuum. So again, this table, we're looking at the same information from the last slide, but it's trended over time, and you can see that home health users are becoming more clinically complex over time. Again, I don't think this is surprising. I think we see this trend throughout many aspects of the Medicare program, but once again, it's happening here in home health, and we know that home health users are more complex. So there's an increasing number of chronic conditions, ADL limitations. You see the growing importance of dual eligible beneficiaries on home health. They're growing, and their use has increased significantly over the last few years. And then you have this kind of increase in the percentage of users with severe mental illness. So as you walk through this, maybe many of these are general trends of the Medicare population, as I said, but given that home health treats this, very clinically complex population, these values do increase, and they increase the pressure on home health agencies to treat and, begin to have the clinical capabilities to treat more complex patients. So that is our kind of wrapping up section 1, and I hope that gives you a flavor of what what is in section 1. I would say that there's a lot more in there that looks at many of those different indicators and different kind of orientations. It might look at dual eligible beneficiaries and their number of chronic conditions and things like that. But that gives you a flavor of the types of information that you can find in the chart book in that section 1 and how you could use it and trend it over time. So now we're going to move from more of that demographic side to the clinical profile. So we really look at patients in terms here of the hospital, for the Part A home health episodes, the hospital DRG, ICD-10 diagnoses, again, looking at the number of chronic conditions. So one thing to note is in section 2, there is some information on the percent of home health users that have 3 or more chronic conditions by state. We don't look at this today because we don't look at any of the state level information, but it is a good flag that throughout the chart book, we do have state information that allows you to dive in a little bit more granularly and see what's happening in states, see the variation across states and things like that. So that's just something to keep in mind, and I will try to note where we do have some information on a state level throughout. So starting here, like I said, this is the clinical profile of home health users. So again, we are looking at kind of the 20 most common DRGs for those beneficiaries discharged directly from the hospital into home health. So again, this is Part A only, so keep that in mind that this is only a subset of all home health episodes in a year, but the top 3 DRGs here, major joint replacement, septicemia, and heart failure have been the most common DRGs from the beginning since we started doing this chart book, 5 years ago. Not to say that that's necessarily surprising, given that these are such popular DRGs in the Medicare program, but it does show some consistency over time with what has been kind of top clinical conditions that have been brought into the, home health and utilized home health. And you can see here, and I think this really is shown on that far right column, which is the proportion for the DRG, that, while there are these kind of high, a few that get a larger percentage of the population, it really does fall off very, very quickly, where most DRGs get a very small proportion, and there's a lot of clinical variation in home health. But that those top, these top 20 are, as you can see on the bottom, 39% of the all Part A claims. And then if you just look at the top, few, that gets you to just about 20%. So it is interesting that there is, concentration in certain DRGs, but then it does kind of drop off after that, and, there's no necessarily pattern in that. So that's all that we're showing for Section 2. Again, there's a lot of information on the state level in Section 2, so we didn't highlight that here today, but just something to keep in mind. So in Section 3, we're looking at the post-acute care market. So now, in the first two sections, we've been very focused on home health users, what they look like, what their profile is. But now we're going to lift up a bit and look at how home health compares to other post-acute settings. So we look a lot at how discharge destination has changed or not changed over time. And that is kind of the main focus here, is how are markets using post-acute care. And this information is available at the state level, and so you can also look at a specific state and see how that state has changed over time. So on slide 15 here, I think this slide has a lot of great information. So first, going along the top, you can just see at a national level the discharges to post-acute care from the hospital. And you can see those numbers along the top. And these really have decreased. These numbers have decreased since 2012. And that's something we've seen, in other areas of research, and some research that we've actually done here at Avalere suggests that this decrease is driven by a reduction in hospitalizations. We also looked here at the number of hospitalizations. We would see that is similarly falling off over this timeline. So it is something that is kind of a feature of this time period in the Medicare program. But then what is interesting to me, and what has been interesting to our team here, is when you look at the distribution of where patients are going to the various post-acute care settings, you see a lot of consistency over time. You see things shift around, but it's, generally just under 60% of beneficiaries are going directly home. There is, a fifth or so going to skilled nursing facilities, and then about 15% going to home health, with the remainder kind of going to all these other very small organizations. So that is what we're seeing here, and this is very consistent over time. I will say that in the chart book, we have this information on a state level, and there you do see a lot more variation, where you see some states use a lot more home health, some states use a lot more skilled nursing, and even some of the higher cost settings such as IRF and LTAC. So there is a lot of variation by state, and then you do tend to see more variation over time when you look at a state level. And I think that's one of the great aspects of the chart book, is that it provides that kind of over time viewpoint, and that, we've done this for the last 5 years, and you can see how in some state, how basically create this chart. It's not in the chart book for every state. That would make the chart book, 50 slides longer, but all of this information, when you look across the 5 chart books, will be able to show you how, an individual state has, fared in their distribution of post-acute care settings. So then, again, we have just spent the last slide talking about post-acute home health and those individuals that have gone from a hospitalization directly into home health. But, we do want to keep in mind and highlight over time that you see that proportion of home health that is coming from the community, that isn't kind of preceded by a hospitalization or an acute event or another post-acute setting. And this is definitely growing over time. I mean, you see that almost 54% from the community. And, when you look over time, you see that percentage growing. I think everybody is aware of that, but it is, a feature of this chart book that we are tracking that over time. So here, in this section, we're going to combine sections 4 and 5 just because they are so tightly integrated with each other. So section 4 is organizational trends in home health, and section 5 is the economic contribution of home health agencies. And these both look at the home health industry at large. So as you can see, as we're moving along, we started with what are those home health users? What do they look like? What's happening in post-acute care? And now let's look at how home health influences the entire, industry, how the industry kind of works at large, how it influences the economic marketplace. So the first is within section 4, it's a lot of information about home health facilities, the number of episodes that we see, visits per episode, and then there's a lot of state level information on the number of Medicare beneficiaries by state who have had a home health episode, and you can see kind of how home health is used in various states. And then in section 5, we look at the home health industry more broadly. So what is the impact on employment, labor, output, and all of those analyses are done on a state level. So it's really useful for state level comparisons and things like that. These, especially section 5, because it provides you with, a lot of information on how home health influences the larger economic, kind of a larger economic marketplace, and then on a state level. So you can see some variations there. So chart 4.2 looks at the number of Medicare Part A and Part B home health episodes over time. And this one is a very long trended analysis. And you see that after a lot of growth in the late 2000s, as we moved into 2010, which I think everyone is aware of the growth in home health over that time, things have very much leveled off, and there even has been some decline in the last few years. Again, this is, I think, knowledge to many people who follow home health and follow home health trends. But it's interesting to see it laid out here and really see that reduction is being driven very much by the post-acute care side and less so by that community-based side, just showing, which I think shows home health importance as a support tool to many Medicare beneficiaries as they kind of live in the community. So now we're kind of stair-stepping down, and we're looking at the number of home health episodes per user. And we see that there tends to be more episodes per user for Part B, so for those community referred home health, and then for the Part A hospitalization, post-hospitalization episodes. It is interesting to see that there's been a little bit more variation in the Part B episodes. There's a lighter blue here where it's kind of creeped up and then creeped down over time, very much in line with where we were 10 years ago, which is always interesting to see how the trends kind of cycle through. Whereas when you look at the dark blue line, which is the Part A claims, you see that things are much more stable and that the episodes per user has been much more stable over time. So that was looking at, number of Medicare beneficiaries who, their number of episodes per user. Now we're going to say, okay, within each episode, how many actual visits do you get in each episode? Again, by parts A, B, and just kind of combined. So again, this is that 10-year trend. And similarly, in some ways to the last slide, you see that there has been more variation on the Part B side, on this community referred side. And they, especially in the past, have tended to be a little bit higher. And now it is much more in line. And there's just been more variation on the visits per user on that side compared to the post-acute side, the Part A side, where it's been much more consistent over the last 10 years. Again, this just kind of, as we drill down, you see that there is some differentiation in how home health is used between those two kind of types of home health. And you're really seeing here that, that differentiation may be kind of lessening at this point. And that could be because the individuals using home health on both sides are just getting more clinically complex, and the care required is more similar. So finally, this is a slide from section 5 of the chart book. And this just looks at the impact of home health on jobs nationally. Again, there's a lot of information at the state level on the economic trends, but we just wanted to show one national view here, and you can really see total home health jobs have increased very, very steadily and strongly since 2003, which is the earliest data that we have here. And I think what I'm sure those of you in the industry have felt this, have seen this, and, this is some of that pressure that we're seeing on labor and the importance of labor, getting good staff. And because, there has been a lot of growth over the last, decade plus. And again, in this whole section 5, there's a lot of state level information. We look at the impact, the economic impact of home health in various different ways, all at the state level and nationally, to give you kind of a very holistic view of what's happening. So finally, on section 6 here, this is outcomes. So we've looked at all of this information on home health, but how is home health truly improving care or supporting the best patient care that for Medicare beneficiaries? So we look a lot at readmission rates. We all know readmission rates are very important to hospitals, to ACOs. Basically, the whole healthcare system has very much had a focus on readmissions for the last 10 years or so. So that's a big focus of this section. And then some of the quality measures compared to other PAC settings. There's a lot of information on quality that is in here as well. So we just provide a few examples here, but this slide here looks at a bunch of different DRGs and the 30-day readmission rate for patients who went to home health versus skilled nursing. So as I said, we do a lot of different comparisons, and I think this is the only time in the webinar that we've actually looked at this comparison of home health to skilled nursing, but that does happen throughout the chart book. This is just the first time we've highlighted here. So on the left column, it's, patients who had a hospitalization. So again, those Part A stays that have been discharged to home health, and then what percent were readmitted within 30 days, and then those who were discharged to SNF and then readmitted within 30 days. I think what I find most interesting about this chart is that you really see a lot of variation in not only in the readmission rates. I mean, you're looking at just the top two lines of, joint replacement at 4% and septicemia at 20%. That, again, there are major differences in those patients, but it is something to see that, there is just a wide range of variation. It really helps you target where those tougher patients are. I think most of us with, most people with a clinical background would not be shocked by this, but it does very much highlight it in a very quantitative way. The other thing I find really interesting about this is that there are, in some cases, very big differentials between home health and skilled nursing, and then in others, there are very little difference. So particularly for orthopedics, you see that larger differentiation, just the first line here, a joint replacement, 4% versus 7%, whereas others, just the second line down, sepsis, maybe it's only 2 percentage points different. In general, the orthopedic conditions tend to have a little bit more of a differential than some of the other conditions listed here. One thing to note when looking at these readmission rates that's really important to keep in mind is that these are not risk adjusted. So there is likely some difference in the populations that are being discharged to the various settings, but it begins to tease that, help you tease that apart here, just to see kind of what's happening. But we do want to kind of caveat that these are not risk adjusted. So going on to the next slide, now we're really diving into that joint replacement, DRG, so it's DRG port 70. And again, this is one of the most popular, or it is the most common DRG discharge to home health. We also know that in a handful of markets across the country, the comprehensive care for joint replacement program is going on. So there's a lot of focus on joint replacement. So we see here, and this is kind of based on the last slide, that overall home health has the lowest readmission rate when compared to skilled nursing and IRF. It is interesting to note that you do see that the skilled nursing and IRF rates have fallen over this time period, whereas you see much more consistency in the home health agency rate. But some of that could just be a little bit of, they're very minor. So, we don't want to read too much into it, but you do see kind of that movement. And again, these aren't risk adjusted. So they're, a joint replacement that is going to an IRF or a skilled nursing facility may look different than a joint replacement going home. But I think it does beg the question, which has been a topic of conversation over the last few years, of which patients really need that higher intensity care following a joint replacement and which can, go home more quickly. And this, highlights kind of maybe some of the differences in the organizations. So that is the last slide that we are going to cover today. Feel free to, we'll pause for a second and see if there are any questions. You can put them into the question box on the, in the kind of GoToWebinar application. And again, a presentation, all these slides, including the entire chart book, are available on the ACI website, and you can see all the slides that we didn't get a chance to cover today.
Thank you so much, Erica. And, as Erica mentioned, doing my job for me, you can ask questions either through the comment box or the chat box, or if you prefer, you can email them to me either now, or if you have questions that you think about that pop into your head later today, feel free to email me and I'll work with Erica and her team at Avalere to try and get them answered for you if possible. Are there any questions that you guys have, or Heather and Erica, that you guys have seen come in?
So one question that, I think we get a lot is, what is this focused on Medicare fee-for-service? What is the focus here? And it is primarily Medicare fee-for-service, as I assume you kind of captured through my discussion. And there is definitely a focus on post-acute care. But some of the slides do try to tease out, like I said, some of the new slides on Medicare Advantage versus fee-for-service to try to start thinking about that, because that has definitely been a very common topic, more recently than maybe when we began the chart book, when things were very Medicare fee-for-service centric 5 years ago.
Great. One question I have is, and maybe you guys can help answer this, maybe not. If I'm looking to use this data in discussions with representatives and in conversations with, possible provider partners, or even non-provider partners, how might you go about, putting this data out there and utilizing it from a business case or a regulatory case?
So I think from a regulatory or even a business case is really to highlight many of the comparisons that are in here. And I think that's the demographic section is really helpful to highlight what do home health users look like? What are the agencies dealing with? What is happening? I think it provides also for advocacy at a industry level. Obviously it's great that it looks at the entire industry, but I think from an individual agency level, this information provides a really great benchmark. So it helps you understand how is your experience different than, the industry at large nationally. Are you seeing a different trend? Are you seeing more acute patients or less acute patients, and things like that, I think are really useful to use this as a benchmark and as a comparison tool.
Absolutely. And, from the Alliance standpoint, while we don't do, advocacy, we do submit regulatory comments, and we always use the chart book data, especially that demographic data, when responding to, the proposed payment system, the prospective payment system proposed rule, because we find it's really helpful in sort of setting a baseline as to what home health patients actually look like. So we utilize that demographic data quite a bit on our end.
Yeah, definitely. And I think some of the state level information is also important because it provides a lot of, it can help highlight how different states and different agencies are dealing with different trends. We see, you can look at that national view, and then you can go down to the state view and think about what is interesting there.
Absolutely. Let me see. It looks like I have a question that's come in through the chat box. When you divide out Medicare beneficiaries discharged into the community, does this include those that were seen for Part B services in their home? If it does, could that be divided out from those sent home without any subsequent follow-up after hospitalization?
Yeah. I mean, there's definitely a lot of different ways to look at that, and we could and I think what you're getting at is over time, there's been a lot of discussion of how to organize, what is the right time to use post-acute care? What is what post-acute care is right at the right time? And I think going forward in the chart book, that's something to consider. How do home health users look to individuals who don't use post-acute care at all, who are just going into the community immediately, and making that comparison maybe interesting. And I will say, this is a plug for the chart book, and definitely if there are things that you are interested in seeing in the chart book, we do make small edits over time with each subsequent release. So that is definitely something to keep in mind, and share that feedback with Jen.
Absolutely. I have, it looks like, one more question that's come in, and I don't actually know, Erica, if you have an answer to this or not, so I'm just going to put it out there, and feel free to answer it if you do or don't. But do you have any comment on the effect or lack of effect of bundled payment care initiatives seen in post-acute referral patterns following hospitalization?
Yeah, that's a real great question. And, you definitely do see in bundled payments that is a important aspect of what, here at Avalere, we work with a lot of providers who are participating in bundled payments, and they're definitely thinking about how do they optimize that use of post-acute care, how do they optimize where patients go. And so you do see that at a very granular level. And you see that start to shift, and you've seen that shift at a state level and a market level. I will say we at Avalere have been in some ways surprised by is that you do see nationally, when you look very broadly, that the distribution hasn't really changed. But we do know anecdotally, and by the data at the more granular market level, you see some changes. So how that will play out on a national scale when we talk about, BPCI Advanced really kicking off. I mean, it's only been in effect for, barely 6 weeks now. You see potentially a second cohort there. I mean, Secretary Alex Azar just announced that, they're reconsidering the cardiac bundles that were canceled roughly a year ago. So as these programs grow, are they going to have an effect on a national level or continue to be, very market driven? And I think that's why the state level information in the chart book is so useful, because you can look at a specific state and see how that, distribution has changed over time.
Thank you so much for that answer, because I know it goes a little bit beyond what we've got in the chart book, but it's really a fascinating thing to look out for, and may end up being something that we might be able to chart in the future, but just right now we don't have the data from 2 years ago, which is mostly what the chart book data is. That is the last question that I have. I have one question about providing more information about how to access the state level of detail, and I think that refers to the stuff that we already have. On the Alliance's website, you can go under the Research tab, Research and Data tab, to the Home Health Chartbook, and all of our state supplements are there. We do not have a specific state supplement for this year, but we've done them in the past. And then also under the Home Health tab, we have a tab called State by State, or it's called State Home Health Data, and that provides state level data in patients and workforce and home health and post-acute care. We may be adding something to that as well as we look into the future, and we'll certainly be updating those one-pagers with this year's chart book data as well. So,
and one more thing I'll add is some of the stuff that I was mentioning, it is in the full chart book. There are, a handful of slides that go state by state by state.
Yes.
In addition to the supplements that Jen mentioned.
Yes, absolutely. And those do get updated, as I said, annually in those state packets and one-pagers as well. So I think that's all I have, and I really appreciate, Erica, your time, and thank you everyone for attending today's webinar on the 2018 Home Health Chartbook. As a reminder, a replay of this webinar will be made available within the week and available on the Alliance's website, just in case you have you want to look back and refer to it. We have the state one-pagers that I mentioned that are on our website. And should you have any questions about the Alliance, membership, or 2019 research funding cycle, please don't hesitate to reach out to me via email at jschiller@ahhqi.org. Thank you all again, and have a wonderful day.
Great. Thank you.